So to quickly go over the agenda for today's call, we're going to start by just providing a few agency-related updates, just to keep folks in the loop on what's going on here at the Council on Developmental Disabilities. We are also going to then jump into the SOGI data, updates on data collection. Then we're going to point you, as I mentioned before, to some resources to assist in that collection. We're also going to be joined by Jonathan Martinez from Burton Blatt Institute. They are a co-partner in a CDD-funded project called Proud and Supported. So you'll get to learn a little bit more about that initiative. And then, of course, we're going to have opportunities throughout today's meeting for questions. Just a few kind of etiquette pieces. If folks just don't mind keeping yourself muted while we are going through the presentation. You're more than welcome to be asking questions throughout, so you can post them in the chat. There is also going to be a period at the end of the initial presentation to ask your questions, but you are more than welcome to put it in chat. We have a number of staff on the call who are going to help moderate. You can also use the raise hand function if you're comfortable with that. It is built into WebEx, and you also, if you're on camera, can do, raise your hand, some sort of indication that you have a question or comment. I also wanted to flag there's a couple upcoming calls that we are going to be hosting. The next one's going to be in a little over a month on submitting your quarterly reports. So we have a number of grantees on the call, all at various places within your grants. So if you are a new grantee and this is going to be your first report that's going to be due at the end of April, I highly encourage you to join that call just so we can give you more in-depth guidance on completing and submitting your quarterly report forms leading up to that April 30th date. And then on June 18th, which is a little ways away, we have kind of turned our June check-in calls into a networking session, and it's a really good opportunity for all of our grantees to give a little bit more information on your projects, and then to potentially share resources with one another. So I think it's a good way for potential collaboration between grantees and at least being up to date on some of the other exciting things that are happening in the field. All right, so without further ado, we're going to jump into introductions, and I think we have a small enough group right now where we can pass it along. So I'm just going to call on folks, and when I do, if you don't mind introducing yourself, your organization, and maybe the name of the project that you're involved with. So first I see Ashley.
Okay, hello everyone. My name is Ashley Orgill and I am the Workforce Equity and Retention Specialist at AHRC NASA. I also work as the chair on our DEI Community and Culture Committee of Citizens Options Unlimited. And I am working with Dr. Sarah on the Community of Practice on DEI grants.
Great, thank you very much, Ashley. Carol?
Hi, everyone. I'm Carol Napierski, and I work for New York Alliance for Inclusion and Innovation, and I'm the Vice President of Program Management and Grant and Program Development. And we have one housing grant. It's called the Housing Resources for Independent Living, funded through the CDD. Thanks, Drew.
Thanks, Carol. MJ?
Hi there, my name is MJ Sayas. I am the grant coordinator here at AHRC Nassau, colleague to Ashley Orgill on this call. We are working on the DEI New York State Community of Practice 5-year grant. We also do have a language translation grant in which we were awarded by the CDD as well. So yeah, that's who we are. Thank you.
Great, thank you, MJ. Christina?
Hi, I'm Christina Loja. I'm the New York State Coordinator for the Center for Disability Entrepreneurship. That's through the New York State Small Business Development Center from Farmingdale State College.
Thank you, Christina. I also see a call-in number, no name attached, a 716 number that ends in 35.
Hi, everybody. It's Valerie Smith, and I'm joined by my colleague, Dr. Christina Muley. We are calling in from the University of Rochester, our University Center for Excellence in Developmental Disabilities. We have the privilege of partnering with the Onondaga Nation just near Syracuse. We're actually in the car on the way home from a visit there today. So Christina's a pediatric psychologist. I'm a behavior analyst by training, and we're partnering with the Onondaga Nation School. Thanks.
Wonderful, and thank you for joining us on the road, Mallory. All right, Sarah?
Hi, everyone. I'm Sarah Gonzalez Noveri, pronouns they, them, she, hers, and I am the DEI officer for AHRC, Nassau, and affiliated companies.
Great, thank you, Sarah. Brandy?
Hello, I am Brandy Solomon. I am Employment Project Coordinator for the Strong Center for Developmental Disabilities, our USED through University of Rochester with Valerie. And I'm working on the Advanced to Apprenticeship grant from CDD. That's all about pre-apprenticeship instruction and wraparound supports for teachers, instructors, and students.
Great, thank you, Brandy. Darlene?
Hi everyone, my name is Darlene Schieber. I'm Director of Training for a organization called Yes She Can based in White Plains. And we are working on a mentorship program for individuals with autism.
Thank you, Darlene. Emma?
Hi, can you hear me?
Yep.
Okay. My name is Emma Wong. I'm the program coordinator from the Queens Special Needs Division of the Chinese American Planning Council. We are working on family employment awareness training, or FEAT. Yeah.
Thank you, Emma. Julie?
Hi, I'm Julie Feely. I'm with the Get There program, and we have a grant that is for travel training for people with developmental and intellectual disabilities, teaching them how to use the bus and other forms of transportation.
Thank you, Julie. Kelly?
Hi everyone, my name is Kelly Weiss. My pronouns are she, her, and oh, my video is not working. There we go. I work for the New York State Council on, no, I don't. Sorry, I work for New York State Office for the Prevention of Domestic Violence, and we're partnering with the New York State Council on Developmental Disabilities. I'm working on a project to increase accessibility of domestic and sexual violence services for survivors with developmental disabilities.
Thank you, Kelly. Luz?
Hi, good afternoon. My name is Luz Osuba, and I am with Corporation for Supportive Housing. We have a grant to do an assessment, an internal assessment for CDD with two counties. My colleague is here as well. I see her just popping in, so she will go into it a little further. Thank you.
Thank you. Sarah? Sarah, are you there?
Hi, yes,
well,
sorry.
Oh.
I have multiple people coming into my office, so. But I'm pretty sure, are we still introducing ourselves?
No, my apologies, Sarah. The names are getting thrown around on my screen. So if I call you out again, that is my apologies.
Oh, no worries.
All right. Sophie?
Hello, good afternoon. My name is Sophie. I'm from the Queen Special Needs from Chinese American Planning Council. My colleague Emma's here. I'm the project manager for FEAT, that's Family Employment Awareness Training. Thank you.
Thank you, Sophie. Stephanie?
Hi, everyone. I'm Stephanie Crumpton, also from the Corporation for Supportive Housing. I am a single program manager, and I'm also the project manager for the grant that we received from CDD, and it's for the Community Needs Assessment, people with developmental disabilities in the Bronx in Chattahooga County.
Great, thank you, Stephanie. And are there any, so I do see, Jonathan, that you have joined. We'll give you a chance to introduce yourself when we get to that presentation portion, but thank you for joining us. Are there any other grantees on the call that I did not call on?
Hi there, this is Celestia, and I'm from the Burton Blatt Institute at Syracuse University.
Thank you for joining, Celestia. All right, and then I'm going to quickly just go through the staff that are on the call. My name is Drew Webster. I am a Communications and Grants Coordinator at the Council. We are joined by Anna DeRosa, Kay Broughton, and Kira Topaske, who are all Grants Coordinators. So one of the four of us should be kind of your direct contact at the Council. It's really nice seeing a good, robust group of grantees because I get to hear about your projects, but it's very nice to put a face to them. So thank you all for joining. And then lastly, Jen, I will give you a chance to introduce yourself since you are co-presenting today.
Hello, everyone. My name is Jennifer Goldman. I am the federal liaison here at the CDD. I am responsible for interfacing with our federal funders and also making sure that we meet our federal reporting requirements.
Thank you, Jen. And then lastly, we are also joined by Kimberly Berg, who is a program planner at the Council. So again, thank you all for joining us today. So let's get right into it. So we did want to start off by providing a few agency updates. As I think most folks are aware, March is Developmental Disabilities Awareness Month. The theme this year, as designated by NACDD, who is the National Association of Councils, was a world of opportunities. So I know we here have had a lot of fun digging into that theme and, you know, having a lot of exciting opportunities to work with self-advocates to promote a world of opportunities. And actually, I'm wondering if one of our council staff may be able to pull up the web link and post it in the chat for where we have a lot of this information saved. So what you're seeing on the slide right now are a collage of drawings done by self-advocates across New York State. We did a call out for artwork, and we had a pretty overwhelming response. We put it all together into about a 6-minute video. So if you're interested in seeing those photos, certainly you can visit the webpage. Thank you for posting, Anna. That is one of the links within there. We also have 3 different, so let me move along. We have more. Yes, we also have 3 separate videos that we did. Self-advocates around New York sent in videos, and we had so many that we had to break it into 3 separate ones. So we have one where folks are telling us a little bit about them and what makes them proud. We have some that is looking at the theme, a world of opportunities, and the different opportunities that exist within their lives. And then one looking towards the future and things that we can be excited about moving forward in this field and for people with developmental disabilities. So again, you know, we've had a lot of staff work on these really kind of exciting and nice reminders about the importance of, again, all the work that you are doing and, you know, really the reason why we are pushing forward a lot of these projects. So if you want, again, kind of a nice friendly reminder, please visit the webpage and see some of the great things that we've been collecting throughout the month. The last point here is on Qualtrics. So several of you know who have worked with the council for a while. We are looking to implement a new reporting platform specifically for program data. It's through a platform called Qualtrics. It works very similar to like a SurveyMonkey. It's essentially an online survey that you'll take to input the data that you're going to be collecting. We're hoping that'll kind of streamline the reporting process, making it easier on both of our ends when it comes to program reporting. We're looking at a rollout date of potentially the July 31st quarterly reports, but we will certainly keep folks up to date as we get closer to that rollout, but we did want it to be on everybody's radar. All right, so moving along from agency updates, I'm going to pass it over to Jen to give us a rundown on the update to SOGI data.
All right, thanks, Drew. So this new data requirement is a result of an executive order signed by President Biden. It was signed into law on June 15th, 2022, but we were awaiting guidance from the federal government as far as the details of implementation. So that's why there's a little bit of a delay. And the purpose of it is to advance equity and inclusion in data collection and also decision making for federally funded grants. and also promote federal inclusive data collection practices. So the specific purpose is to advance equality for people who identify as LGBTQIA+. Next slide, please. So why should we collect SOGI data? So everyone has a gender identity and a sexual orientation. Those can vary widely, but that's part of everyone's identity, no matter how you identify. And currently, SOGI data collection is not standardized. There's gaps in information. There are different definitions used, and this means that there's less data analysis and less information available to help better serve the LGBTQIA+ population. And we know that this population experiences significant disparities in access and quality of services. So this can result in poor health outcomes, poor long-term social outcomes, and other negative results. Next slide, please. So you may be wondering, how many people identify as LGBTQIA also have disabilities. So this is sort of just a snapshot. So you can see that this really is an important part of the work we do. So 2 in 5 people with disabilities identify as transgender adults. 40% identify as bisexual men, 36% identify as a lesbian woman, and so on. So you can see that this is really relevant to our work and something that we should focus on. Additional studies have shown that people who have autism also have a higher percentage identifying as being LGBTQIA+. So that there is data and research to back up that this is, something important that we really should be investigating and tracking. Next slide. So, so now we're going to get into the specific requirements of the SOGI data collection. So starting April 1st, we'd like all of you to collect SOGI related data from your participants. And I'll go through the actual questions in just a minute, but it's important to know that the questions, the way they're presented to you, can't be rephrased or use different terminology. This was very specifically told to us by the federal government. And you'll see in a minute, some of the terms are not perfect, and we gave some feedback to our federal funders that we would like to have seen them presented in a different way, but unfortunately, we must abide by their requirements. One special dispensation we did get is the federal government has allowed us to add an additional gender identity, gender X. You may recall that Governor Hochul signed an act into law, the Gender Expression Non-Discrimination Act. That was in 2022. And that added gender X as an identifier to New York State demographic data collection. So, we're sort of bound by 2 different sets of requirements here. We are required by state law to add gender X to our gender identifiers, and we're also required to use the federal terms. So as I said, we have a special dispensation to add gender X to the choices, but we also need to keep the remainder of the terms the same. As always, with any sort of demographic information, the participants must self-report this information. Their responses should be anonymous, and also reporting this information is completely voluntary. Drew will talk in a minute about the TA documents that we are going to provide to you to help explain to your participants why collecting SOGI data is important. We know that some people might find reporting on SOGI data to be a little uncomfortable, as this for some people can be more private information. So, we really encourage you to emphasize the importance of it while also emphasizing that, giving this information is voluntary. Next slide, please. Okay, so these are the required questions that you'll need to add. There are 3 separate questions. Some of it is already encompassing the gender data that you were previously collecting. As I said before, you might see some of these terms and not really love them, and we know they're not perfect, but these are the ones that we need to use. And you need to not only phrase the response answers in this way, but also the way the question is specifically asked. Our federal funders invested some resources to have researchers determine the best way to ask these questions and answer choices, the best way to word them. So this was the result of that research. So the first question is, what is your current gender? And the answer choices should be man, woman, non-binary, the New York State requirement for gender X, Two-Spirit, which you'll see is highlighted there. We're going to talk about what that means in a minute. I use a different term with a free space so that they can enter their own text and then prefer not to answer. The second question related to gender identity would be, do you consider yourself to be transgender? With the answer choices being yes, no, and prefer not to answer. Next slide. And there's one question related to sexual orientation, and you should ask participants to select one. Which of the following best represents how you think of yourself? So the choices would be lesbian or gay, straight, that is not gay or lesbian, bisexual, two-spirit. I use a different term, again, with free text space to enter that different term. I don't know, or I prefer not to answer. So two-spirit. Two-spirit is a term used in Native American and Alaskan Native community, and it refers to people who can be male, female, or intersexed individuals who do the combined activities of both men and women and have unique traits to their status as a two-spirit person. And the usage of two-spirit in your data collection, the parameters are very specifically laid out by our federal funders. So you should only provide two-spirit as an answer choice if your participants select American Indian or Alaskan Native as their race. And skip logic can be used on an electronic survey. So you should definitely not provide two-spirit as an answer if you're using paper surveys with your participants. And we only want participants to be able to see two-spirit as an answer choice if they've previously selected American Indian, Alaskan Native, as I said before. So you need to be able to use skip logic to not even show that as an option, because we don't want people identifying as two-spirit if they haven't identified themselves appropriately with their race. So I'm going to pass it over to Drew to talk about the resources we'll be developing and providing, and then I think we'll pause for any SOGI data related questions.
Thank you, Jen. So yeah, we have a few resources to assist in, one, the collection of this data, and then two, in the reporting. For those of you who have used it before, we do have a satisfaction survey template that we provide to grantees to assist in collecting demographic and satisfaction data. We have built out pretty much the same way that you see the questions in the previous slides. out onto the satisfaction survey. So, we certainly encourage you, if you have activities that you're hosting, to use the questions on that survey when you are collecting your data to report in your quarterly program reports. We are also going to be sending out an updated version of the program report, which has areas built out in the demographic section on where you can input these data points after they've been collected. So again, starting April 1st is when you should start collecting that data, and we would expect to see, if you do have activities to report on, that data to be included in your reports that are going to be due on July 31st. So that is, a bit of the timeline of the rollout. We also have a collecting demographic data TA document that goes over more details than just kind of these updates, which we'll send around kind of as a reminder of why we collect demographic data. And the last, those are the 3 resources. So we're also going to be sending out the recording of this video afterwards too. So you'll be getting all of this information in one package from your grants coordinator this week after the call. We'll also have a spot on our website that'll host this information as well. So you should be able to access everything, and we are certainly open to feedback, because these are our new resources. So definitely let us know as you get working with it and what you're seeing and experiencing. Feel free to share that with us. So at this point, I think we're going to take a quick pause and open it if anybody has any questions related to the new requirement. And I see, MJ, your hand.
Hi there. Thank you. So I did have a question in terms of the question where it says which best represents self. So I mean, while I know that this language was given to you guys, I am part of the community, so I kind of know there's other intersections of identities within the acronym and whatnot. But I noticed that one thing that was missing was pansexual. Now, pansexual and bisexual are not considered to be the same thing, but there are similarities between the description of those 2 demographics. Now, we will obviously give on our paperwork these selections, but if someone wrote in on their form that they were pansexual, can we group in those numbers with the bisexual category?
Shall I take this one, Drew?
Sounds good, Jen.
I would say if someone is specifically identifying themselves as pansexual, that should be counted separately from bisexual.
Okay, perfect. I wanted to make sure, but I wasn't sure because I know there is a finite list here. So thank you. I appreciate the specification.
Thank you.
Stephanie?
Hi, thank you so much for this information. It's been very helpful as we're going to do data collection. But one of my questions is in reference to the option for Two-Spirit. I know you said it's only for anyone who identifies as Native American or an Alaskan Native. My question is, you don't include, I just want to make sure I understood it properly. Do not include it in paper copies. It can be included on the electronic version if we are sending out electronic versions of, our needs assessment. That's the first question. Is that correct? So it can be added on the electronic, but definitely don't do it on paper?
On an electronic survey, only if you're using skip logic. So if you have a survey that you can tweak so that I know you can do it in SurveyMonkey. So the choice of Two-Spirit only shows up if a person selects Native American or Alaskan Native.
Okay. Okay, that's helpful because we do have SurveyMonkey, and my question was going to be, what if it wasn't integrated in the first part of the needs assessment? How would we capture that information later? But we can just add it in via the first part of how we're rolling out the needs assessment and just use the skip logic. So that's very helpful.
Okay.
Thank you.
Any other questions related to the new data requirement or reporting? All right, I am not hearing any. So at this point, I'm going to stop sharing my screen. And then Jonathan, I'm going to see if we can give you the correct permissions. We can make you a presenter that should allow you to share your PowerPoint. So we're very happy today to be joined by Jonathan Martinez, and I believe Celestia from your team as well, who is going to present on the Proud and Supportive Initiative. That is a CDD-funded initiative with a few project partners. But without further ado, I will pass it over to Jonathan to tell us a bit about that grant work. Thank you, Jonathan.
So much, Drew. Thank you, everyone, for attending. My name is Jonathan Martinez. I am the Senior Director for Law and Policy at the Burton Blatt Institute at Syracuse University. It's my pleasure, my honor, actually, to meet with you today to talk to you about one of the best projects I've ever been a part of. This is a first-of-its-kind project that has been badly needed for years, and I just want to begin by thanking the Council for supporting it. I am here at the request of our lead partners, who could not be here today. So I get to say thank you twice, once to them for their work, once to you for your support. And with that, let me share my screen and tell you a little bit about the project. I'll begin. The project is called Proud and Supported. It's been around for about 3 years now. It was a 3-year grant. The whole point of the Proud and Supported project is to work with people with intellectual and developmental disabilities who identify as LGBTQIA+, and the people who support them, the staff and the DSPs. So we can identify best practices. We can finally get to working with what works best for people with IDD. And that is so badly needed. Because what we know from study after study is at a time when things are getting a little bit better for people who are LGBTQIA+ in the larger community, they are not getting better for people with IDD who identify as LGBTQIA. They are consistently desexualized. People look at people with IDD and determine that they can't possibly form relationships or don't deserve to have relationships. And it's even worse when they identify as something quote unquote outside the mainstream, like being LGBTQIA+. Their sexuality is then made into a problem, not just something they shouldn't do, but something that is a problem that is not accepted by society at large and the people who support them. And because of that, because of what we see as a lack of information and training given to people who work with people with ID who are LGBTQIA+, we see staff members using, I guess, what's best called as protective approaches, which I think a better way to put it is just tell them not to have sex, or don't let them have sex, or prevent them, or tell them that sexual relationships are bad. And as a direct result of that, people with IDD who just want to have relationships like everyone else, who want to be around people they love and can love, are made to feel uncomfortable about it, that their bodies are somehow wrong, that their desires to be around people of their own gender or to just exercise their sexuality the way they want to do is shunned. And they don't get the supports and services they need, not just the supports and services they need to exercise their sexuality productively, safely, and intelligently, but also supports and services they need just to live better and more inclusive lives. And that is one of the worst problems, because as a result, people who are LGBTQIA, who also are IDD, often find themselves with nowhere to go and nothing to do to understand how to interact with others safely, how to exercise and express their sexuality in a healthy and productive way, and wind up, as some studies show, having sex in places where they don't feel comfortable, or being coerced into unhealthy sexual relationships and outcomes that leads directly to negative outcomes like abuse, neglect, disease, and sometimes death. So what's even worse? I mean, if that's not bad enough, what we know is that people with IDD, as a general rule, receive less effective supports and services. We have data showing that people with IDD, for example, are both under and over diagnosed, under and over medicated as a general rule. And now add into that a person with IDD being LGBTQIA+, that becomes a kind of double discrimination, studies showing that. For example, we know that people who are transgendered face discrimination at higher levels for services. But people who are transgendered who also have disabilities have it even worse. They receive even more severe types of discrimination and even worse services. We know that people who are LGBTQIA+ experience higher rates of crimes. But we also know that those who have disabilities have even higher rates of victimization. So that's why we're here. We're here because of the experiences of people like Caden Clark, an autistic transgendered man who was denied access to care until, quote unquote, his autism was cured. And I wish I could say a phrase like that is something that's on its way out, but I work around this country and I hear all the time things like that, that someone with a developmental or intellectual disability has to overcome it or be cured or I'm sorry, I'm emotional about this, or somehow become something other than who and what they are in order to get that which everyone deserves. And in Caden Clark's case, it was a life and death situation that resulted in death. He could not get the supports and services he needed because of his disability. It was made worse by the fact that he was transgendered because he needed specialized care. And he had what was an entirely predictable mental health crisis where he was then killed by police. This is what we see far too often. People who are LGBTQIA+, who are victimized because of it, who are victimized once again because they also happen to have IDD. And that's why we're really here. I'm so sorry to begin this presentation on a down note, but that is why we're here. There is a critical need to make sure that people who work with people who are IDD, who identify as LGBTQIA+, have the training they need, have the knowledge they need, the understanding, and frankly, the attitude they need to work well with people who are LGBTQIA+, who have IDD. That is the primary purpose of the grant from the DDPC, and we thank them for it. We decided to go a little bit further. The RFP called for a program specifically to work with DSPs and staff members. We wanted to do more. So as part of our project, and I'll tell you about this, we are also realizing that there is a critical need for people who are with IDD, who are LGBTQIA+, to have the information that they need, to make sure that they can get the things that they need, to understand that their sexuality, their lives are positive things, and to express their sexuality positively, to recognize potentially abusive situations and avoid them, to respond to abuse, and to find ways to feel better in a community that often does not want them to feel better. That is the purpose of why we're here. Here's who we are. Our lead partners are the National Alliance for Direct Support Professionals. Desiree Loxbauer and John Rafferty are the chief partners of this project. And NADSP is a nationwide organization headquartered in New York whose entire goal is to work with staff members like DSPs to help them increase their skill, to improve their recognition. And they have created targeted curricula around this country that trains and certifies and has a code of ethics for DSPs and staff, including training specifically relevant to people with LGBTQIA+ who are IDD. Our second partner is the Autistic Self-Advocacy Network, one of my favorites I've ever worked with. They are run for and by autistic adults, and as well as people with IDD. They train, they provide amazing advocacy. Their website is autisticadvocacy.org, and they have a special interest in this issue because not only is it important to members of their community, they live this issue, as over 80% of ASN staff identify as LGBTQIA+. And finally, the Burton Blatt Institute. I am the Senior Director for Law and Policy. Celestia Orazda is here as well. She's our Chief Technology Officer. We lead national, international efforts. I have appeared before you before talking about supported decision-making and other issues facing people with IDD. But we have worked nationally and internationally to help people with disabilities, working with people with disabilities to ensure that they have what they need, what they deserve to live their best, most inclusive lives. Together, we have formed this project to work with people who are LGBTQIA+ to help them get what they need to live their best lives. But it's not just us. In fact, if it was just us, we wouldn't be doing our job right. From day one, we have made a goal to work directly with, receive input from, and frankly be supervised by people who live the things that we're going to talk about, people who have ID, who are IDD and are LGBTQIA+, starting with our advisory council, which from day one has been made up of a majority of people with IDD who are LGBTQIA+. They help guide us each year. They help describe and help us develop our curricula, which we're going to talk about in a moment. They help us make it better. We run it by them. We have LGBTQIA thought leaders we have sought out, including one of my favorite people who has since passed on, named Dave Hinsberger, who have been leaders on this topic for years and years, who talk to us about real world experiences facing people with IDD or LGBTQIA+, real world experiences, real world needs. And lastly, we have LGBTQIA+ co-trainers, people who with IDD, who live this, who work with us. I'm going to show you a sample of our training in a moment, who train with us and talk with us and deliver the proper message in the proper way with us. Here's what we're doing. First and foremost, what this grant called for us to do was to create education and training programs specifically for DSPs and staff. And we have done that by each year developing a specialized curricula touching upon a different aspect of working with people with IDD who are LGBTQIA+. We have created educational materials, handouts, things that people can take back to distribute to coworkers, helping people understand best what best practices are, what they should be looking out for, how they should be addressing, and how they should be working with the people that they support. And we have done training across New York, both live and virtually. With the pandemic, we have done more virtual trainings. And as they have gone on, they have been archived on our website. There is a link on your screen that you can click on and see one of our archived trainings. As I'm going to tell you later, we don't just do trainings, we also collect data. This is helping us understand and recognize where additional training is needed, where their issues are, and where resources are needed best. There is an example of our training I'd love to share with you now. It's a quick clip from one of our sites. So I am going to stop sharing. Hopefully that worked. And I'm going to stop there. If I can make this work, I'm going to share again. And this time go.
Sorry to interrupt, Jonathan, but when you share, I know with WebEx, sometimes there's a little box at the top where you got to turn the audio on or else we may not be able to hear it. So just be on the lookout for that.
Let's hope it works. So Drew, do break in and tell me. I'm seeing a box that is unmuted. So hopefully it will work. Please tell me if it doesn't.
The terms we use to describe our identity and our sexuality have changed a lot in recent years. For many, this is liberating as we have more accurate and respectful ways to refer to one another. For others, it can be confusing. Right, Matt?
That's right. I identify as a gay man, but the language that I learned when I first came out has changed dramatically.
Here are some of the ways people identify. Straight. Someone who is attracted to people of different genders from their gender.
Gay. Someone who likes people of the same gender they are. For example, a man who only likes men is gay. Sometimes the word gay gets used to mean the whole LGBTQIA+ community. For example, someone might say they're going to a gay pride parade. They don't mean it's a pride parade only for people who like the same gender that they are. They mean it is a pride parade for the whole LGBTQIA+ community.
Lesbian. A woman who is attracted to other women.
Bisexual. Someone who likes people of multiple genders. For example, someone who likes men and women.
Pansexual. Someone who is attracted to people of many or all genders. The meanings of bisexual and pansexual overlap, and that's okay. Some people identify as both pansexual and bisexual.
Asexual. Someone who isn't sexually attracted to anyone.
Aromantic. Someone who isn't romantically attracted to anybody.
Two-spirit. A word some indigenous people use to talk about indigenous LGBTQIA+ people.
This is important. Gender. How you feel and see yourself and what you call yourself For example, man, woman, non-binary, genderqueer are all genders.
Transgender. Someone whose gender is not the same as the sex they were assigned at birth.
Non-binary. There are more genders than only man and woman.
Cisgender. Someone whose gender is the same as the sex they were assigned at birth.
Hopefully that came through. That was a small clip from a much larger training that we developed and provided and had filmed professionally. But here's something that's important as well before I get back to my PowerPoint. That training is an example of us making sure that we're doing our job well and getting feedback from people who are directly impacted by it. We're going to be updating that training because some people who saw it said, you know what? We use the term likes when using bisexual and some of the other genders, and use the term sexually attracted to when addressing others. We should be consistent. Likes could just be fraternal. We're talking about identity and attraction. We're going to be making our phrases more specific, using attracted to rather than liked. It's not because we did a poor job, but it's because we can do a better one. And people listening to us and watching us help us do exactly that. Other things that we are doing. I need to get back into the slideshow and from current slide. Other things that we are doing, we're working directly, like I said, with people with IDD who identify as LGBTQIA+. We have developed specific resources in easy read and in other formats to help people who are IDD understand and address their sexuality and express their sexuality, and just as importantly, work with the people they support so the people they support understand their needs and what they want. An example, there is a link on your screen for that, what we call our rights and respect document, written in an easy read format, designed by our incredible partners at ASAN who specialize in accessible material. I think if you click on that, you'll like what you see and like how it is presented. And we are presenting at conferences targeted toward people with IDD. I've always thought as a presenter, you go where people are. It's not enough just to say, come to us, we go to you. What we're doing, we have a website that's launched, proudandsupported.org, for which we have to thank Celestia, who is here, who did a great job formatting and putting it together and populating it. You're seeing a photo of the front page of it. A link is there at proudandsupported.org. This is a sustainable website. It will go on after this grant ends. As a side note, I'd love for this grant not to end. But it will live after we do. Our training will be archived. Our resources and materials will be there. We will keep it updated so that people know that there is a place to get that information, that there are people who actually who are going to strive, to understand what people want, what people need, and help spread that word. We are knowledge translation. We've already had one article come out. It's a terrible screenshot on your screen, but there is a link to it. John Rafferty, our lead trainer, was published in a journal called Impact, describing the project and what it is that we're doing. And I will tell you this, again, I speak around the country on many issues, and every time I talk about this project, what I hear is, oh my God, we have got to do this in this state. So once again, to the council, thank you for your foresight. I think you're going to find that you're going to make a difference around the country. This article is just one example. What we're also doing is collecting data, collecting and analyzing data. Like I said, we ask our training attendees to tell us what they think. If you go to the website, you'll see that before you can access an archived training, we actually ask people for input at the front end and at the back end to help us gauge where needs are and whether we're meeting the needs and the desires for information. We're going to be publishing an article on our findings. That's going to be primarily my job. John and Desiree are our lead trainers along with our partners. I am hoping to pull the data together to show the impact that we've had and the impact I think that still can be had by building on what we've done. And that is a quick overview of who we are. I spent the whole first part giving what I think to be is rough information about why we're doing this. But really why we're doing this? Because it's a community that we're building. It's a community that exists. It's a community that deserves to be respected and expanded. the IDD disability community, the LGBTQ plus community, the human race community. We all have the exact same needs. We want to be who we are. We want to be self-determined. We want to do what we want, love who we want, and live the lives we want. I think that any advocacy we do, that IDD advocacy, that disability rights advocacy, that LGBTQIA plus advocacy, they all come from the same place. Make your world part of the larger world. And it has absolutely been my honor to be part of this world. And I'm happy to answer any questions.
All right, thank you so much, Jonathan, for joining, for giving that wonderful presentation update on the great work that is being done on the Proud and Supported initiative. Seeing some animated hands clapping, so thank you, folks, for being active participants in this. But yeah, if there are any questions or comments for Jonathan, I'm going to open it up to the group. I see MJ, your hand.
Hi, Jonathan, and thank you, Drew. Hi, Jonathan. It's definitely a comment. I just wanted to say I really appreciated your presentation, and I really appreciated that you led with, Caden's story on there. I think we need to have those conversations, those really hard conversations about some of the darker moments of what happens to this community and the intersection of these two communities at large. So I really just appreciated what you said and what you shared, and your emotion coming through on there really shows your care for the work. For just someone with that lived experience, it really means a lot to me to see service providers really leading with their hearts on this type of work. So thank you for what you're doing, and thank you for your presentation.
Thank you.
Of course.
All right, and then we do have a question about, can you share your contact information? So Jonathan, I don't know if it would be yours or maybe Desiree or John, as far as who would be the best to connect with to get more info.
What I'll do is I'll put my information, and I'm not really WebEx conversant. Where is the equivalent of the chat box here? More options?
At the bottom of your screen, I think there will be a chat bubble that you can click to bring it up, if it's the same format as mine.
Put my email in the chat box. And what I'll do, what I pride myself on anyway, is even though I like to pretend I know everything, I don't. If you ask me a question, I don't know the answer, I'll help you find someone who does. It may well be John or Desiree, but knowledge is power. I think we have to have these types of conversations and share our contact information so that we can find the people who do know when there are things that need to be known.
And Jonathan, are you okay if I share the PowerPoint that you shared today with the group afterwards?
Absolutely.
Okay, so yeah, we'll have more materials after the call that we'll be sharing with the group as well. Any other questions or comments for Jonathan? All right, not seeing or hearing anything. So again, thank you a lot, Jonathan, for joining us today. Wonderful presentation. You've been a wonderful partner throughout the last few years doing this work. And, we're excited to see what's to come in the last couple of months here. So again, and thank you to everybody for joining us, going through some of the updated reporting requirements. As I mentioned, we'll be sharing additional resources related to that requirement after this call throughout the week. And if you have any questions in the meantime, you can always reach out to your grants coordinator and we can discuss further. So with that, we'll give you some time back in your day. Thank you all.